Poststructuralism, the theory that challenges the idea of structuralism, was developed in the 1960s and 70s. While structuralism theory pitched is unified and complete explanations, which highlighted the binary oppositions and independence of structures, poststructuralism theory opposed the autonomy of structuralism and deconstructed predefined forms, which underscored a diversity of truths. Post-structuralists argue how beliefs and knowledge are dependent on lingual, cultural, historical, and social contexts, the power of leading figures in society, which allows them to strengthen their beliefs to a wider audience. They also emphasize that comprehensive knowledge and truth are inaccessible as the formation of knowledge involves subjective perception and interpretations rather than absolutely objective discoveries. This perspective was fundamental in the identification of absolute truths, which enabled reflection and exclusion of these biases. Two major concepts correlated with the post-structuralism theory are medical gaze and epistemes.
French philosopher Michel Foucault, who greatly impacted social science disciplines, introduced the concept of the medical gaze in his work, The Birth of the Clinic. This idea was developed around the 1960s at the time when medicine advanced from primarily depending on patients' subjective traits to a more clinical approach. This concept describes the dehumanizing division between the individuality and patient's body. In other words, it focuses on observing the biological features of diseases while disregarding non-biomedical and subjective elements such as individuals' emotions and experiences as a patient. In the sociological aspect, as health practitioners with a medical gaze will diagnose patients through a clinical lens that perceives patients as objects, it emphasizes the inherent power dynamics between patients and the doctor. Although this approach may enable objective comprehension of the condition, it may advantage biological uniformity and ignore individuals' diversities. In anthropological terms, it may overlook emic perspectives, which may fail to socially and culturally capture the individuality of the patient's holistic characteristics and settings, which places those patients in inferior positions. This can provoke health inequities where patients' socioeconomic determinant of health is disregarded.
Let's apply the medical gaze to a patient with low socioeconomic status who has been suffering from chronic pain because of unknown diseases. With the medical gaze, their doctor would merely focus on objective measures, such as previous medical records. They disregard non-biological elements, such as poor nutrition or housing, that may have caused this, and it might also be impacting the patient's condition. This can lead them to feel frustrated as their subjective experience is unacknowledged, and also feel disconnected from their doctor. Accordingly, this could deteriorate the social gradient of disease by filtering out the potential cause of inequalities in health.
Another key concept is the presence of epistemes. Epistemes are ideologies that are so deeply ingrained into society and our way of knowing that they become subconscious rules to cognition. For example, the episteme of the Renaissance era was centered around knowing through resemblance. This led to practices such as the use of walnuts to repair the pericranium due to the physical resemblance between walnuts and the human brain. In contrast, the modern episteme is characterized by uncertainty brought about by the realization that representations or understandings can differ based on perspective. As a result, in the modern era, subjective measures such as observations have been devalued and replaced with more objective measures as exemplified in the adoption of statistical and empirical methods in research. Overall, epistemes subconsciously dictate what thoughts are and are not considered for cognition. This is demonstrated by Foucault, who defines epistemes as systems of assumptions and rules that govern what knowledge is temporally possible or permissible.
Epistemes impact the social gradient of disease by shaping the foundational assumptions, practices, and discourses within public health. The way public health issues are investigated and addressed are facilitated by the episteme. For example, the modern episteme's focus on statistical and empirical methods has led to the development of epidemiology. The ability of epidemiology to frame disease in the context of populations and exposures has enabled a better understanding of the social determinants of health. In the current episteme, there is a growing recognition of how social determinants such as socioeconomic status, demographics, and environment impact health. This recognition enables the development of public health interventions that improve the health outcomes of those most disadvantaged, thereby reducing the social gradient of disease. Overall, it can be seen that post-structuralism theory, with its concept of medical gaze and epistemes, is multifaceted that has a variety of real-world implications that can be either positive or negative.